4:30 here on a lovely day outside. If you like rain, it's and like
Say
that.
it's cloudy and gloomy.
It is not the bestest
How
of
lovely
days.
could that be?
But Saturday, it's like 74 and sunny.
Yeah.
Sunday, 79 and Sunday.
Good days ahead.
Dr. April Ritz is excited about that. You got plans for the weekend?
I do. My husband and I are doing a date weekend.
Well, good for you
Our
guys.
grandparents are watching the grandkids, and we're going to get away a little bit.
Hot
Look at
diggity.
you.
You guys want to come fishing with us? We're going fishing.
Fishing?
Yeah.
That would be kind of nice.
Yeah.
Where are you fishing at?
Newton Lake.
Newton Lake.
Yeah.
I'd rather do other things than fishing.
I understand. That's
okay.
I would too, actually.
All right.
But my wife, that is her preference.
Huh.
When we go out, our date nights are out on the lake somewhere.
That's nice.
It's a good
Relaxing.
time. Very relaxing. And speaking of relaxing, sometimes you need to relax if you're having issues with your body and stuff. And to find out information on how to do this, you go to the pelvic place, right?
Yeah, so
The pelvic
That's
place.
what I call it, the pelvic place.
So for those that don't know what the pelvic place is, it is Effingham Pelvic Health and Wellness on Evergreen. But yes, we do see a lot of patients coming in of all ages, and sometimes their issue is a lot of tension throughout their body, and a lot of people nowadays have high stress levels and busy lives, and that can result in, back pain and hip pain and pelvic floor dysfunction. So
Me and Brian have learned a lot in the past few years that you've been
Yes.
doing these talks. And one of the most interesting thing is sometimes people are too strong in certain areas for their body. It's like you always say, "Oh, just do some Kegels, it'll be okay. Just do some of these, it'll be okay." Sometimes that's not the right move, is it?
you guys are learning. I think you guys could just do these for me. You
Oh,
don't
I
even
could.
be here.
Oh, that'd be
I'm
interesting.
just impressed with the knowledge that, number
we
one,
suck up the knowledge.
Well, the knowledge that you share with them, but then even more shocking that he retains that knowledge.
Yes, good point. Yes.
Retention.
So what he said, if you guys were not listening, is Kegels are not for everybody. So pelvic floor strengthening does not need to be done by all women after having babies. It does not need to be done by everybody. For some people, that will actually make your symptoms worse.
Yes.
Huh.
Which is probably maybe the first time people are hearing this, and there's like, oh, maybe I need to talk to Dr. April whenever it gets to a situation like that to figure out exactly what to do.
Exactly, yes. And it is still being taught in a lot of childbirth classes that all women need to be doing Kegels. But we do have coming up actually a couple classes with myself. So on May 4th, it is a Saturday from 8 a.m. to noon. This is a class for couples to come in, and it is all on pregnancy prep and things that you're not taught. It is a $200 class, and if you're part of our membership, it is a free class. So if you're pregnant out there or postpartum and want to join our membership, this is a fantastic class to learn more. And we go over breathing techniques, things that you should be doing, shouldn't be doing during labor and during pregnancy and postpartum. So just throwing that out there as well.
Yeah,
We do not teach all women to do Kegels.
That's right.
Sure.
But only the ones who need it, right?
Yes, only the ones who need it.
Very good. All
All
right.
right.
I think I like the idea you're doing this. What do you call it? The membership thing.
Yes.
It's going to save you some money in the long run, and it's so much information, and you're there all the step of the way through the pregnancy and the birth and everything. It's very interesting.
Yeah, we have a very extensive program. We actually did training today with the staff, and we went through. We have a pregnancy checklist, a postpartum checklist. We're not missing any of the little things that need to be covered with all patients that are pregnant and in the postpartum period. So if you are interested in that, you can always call our office. You can go to our Facebook. It is like one of the pinned features on our Facebook page to learn more information about our membership. But it's just a monthly fee, and then it covers some physical therapy sessions with us as well as our classes.
Very interesting.
Yeah.
Tony's like, wish we had this back in the days.
Yeah, back in the days. Well, you even came with props today, so
Yes.
I was
That's
actually
right.
pretty excited. I'm like, oh, cool,
Really?
we've got
We love
props.
props. We love it when she brings props in, no doubt about it. So what else are we talking about? You have any
Yes.
other classes coming up besides that one?
We have all of our classes scheduled out and through June. So we have a menopause class coming up in June. At the end of June, we have our menstrual health class for teenagers and adults that are having menstrual health dysfunction. Things you can do for that. April 16th at Family Life Center, I'm putting on a free class for anybody in the community on postpartum care. April 30th at Catching Glimpses is my traditional 2-hour postpartum class. That is $25. But all of that can be found on our social media.
Good place to
Wow,
go.
Yes.
Go check
nice.
that out. Now you
Okay.
brought, like, Tony's wanting you to play with the props.
Yeah, so let's talk about props. So I really wanted to talk this week on Thursday and next, so I guess Thursday's tomorrow.
Thursday's
Yeah, no
tomorrow.
kidding, that's
Yeah,
tomorrow.
Yes, tomorrow
Yeah.
and next Thursday, the 18th, we are doing free screens in the clinic. We do these about every 3 to 4 months. It really depends on my schedule and how what's going on. But tomorrow we have a couple free screens left. We have one left at 11:30 a.m. and then I believe we have a 3 p.m. and a 3:20 screen left. All of our other screens tomorrow are taken.
Oh, wow.
But in this screen, I am covering 4 different things. So we'll be looking at, I brought the prop. We'll be looking at SI alignment. So SI is low back sacroiliac joint. It is like the joint that transfers all of our load from our upper body to our lower body.
It's
So
a very important part of your body.
very important, transfers everything. So we have our spine here, we have our sacrum, and then the ilium. This is the full pelvis. But the joint is, we have a right side and a left side joint. This and this area can get off just a very tad bit for people, but they get right or left sided low back pain. So in the screen tomorrow and Thursday, I will be checking the alignment of that joint and letting you know how you're doing there. And for men and women can have issues with this. For men, sometimes it's if they're sitting on their wallet for a long time and it causes your pelvis to be on level. For women, this can come from multiple different things, but childbirth, postpartum, core weakness, a fall on the buttocks, anything like that can cause that joint to get out of alignment.
Speaking of the wallet thing, somebody told me about this a long, long time ago. Don't put it in your back pocket.
Correct.
Keep it in your front pocket.
Exactly.
I mean, I don't have that much money anyway. So you put what you can in there.
I was actually going to mention that, but
But it really has been a life changer. I do not have that issue anymore. And I think that was a lot to do with it.
And even if it is just if it is a thin wallet with not a lot of money, those few millimeters can cause a difference if you're sitting on that all day long.
Yes.
I bet.
So, some fun facts there. Also, for people who chronically cross their legs.
like I am
Leg
right now.
crosser.
Oh, yeah?
So if you
She
always
was taught
cross,
to be a lady.
yes, if you always cross the right leg over the left leg,
Yeah.
if you're sitting like that all day long, that causes your pelvis. Your pelvis is always rotated different on one side versus the other.
So rotate
So-
them. Huh?
Huh.
If you are going to
Okay,
cross your
so-
legs, go back and forth. But if you're having
Okay.
pain in this area, I just say don't cross your legs until it's
okay.
better.
That makes sense.
Huh.
Yes.
You
I did
do
not-
you have pains in that area?
No.
You are a pain
Good.
in the butt. So I was,
Well, I don't know. I was a pain in the head now, but it was my own head. So,
That's another story.
yeah.
But anyways, yes. So we go over, sometimes some of the patients we're just seeing them for low back pain. And so that's an area we'll be screening tomorrow. We're also screening if you've had any abdominal incisions, whether that is from a colon surgery or a C-section, or if it was an abdominal hysterectomy removal, things like that. We're checking out those scars. I actually had a patient in this week who had kids about 30 years ago. And she was telling me that her scar, when I touched it, she's like, that still hurts. I'm like, does it bother you through the day? And she
after
goes,
30 years?
yeah. She
Oh,
goes,
no.
actually, it does. I have to make sure my underwear, my pants are not touching that
What?
scar.
Really?
Yep.
Oh,
so
wow. That's
we-
not supposed to be that way.
Correct. So we treat that. I told her it's never too late. We can help you with that as well. So we'll be looking at scars tomorrow. We will also be looking at, it's called DRA, diastasis rectus abdominis. So I did bring an image of this.
Okay.
So this is an abdominal issue. So this is your abs. Typically we think of six-pack muscles. The muscles should connect in the middle. With DRA, there's a separation. So some people, when they go to sit up out of bed or do a crunch, they notice a doming down the middle of their abdomen.
Yeah.
And we will look at that in our screens and let you know if you do have that. It is very common. It is normal during pregnancy. It should improve postpartum, but for some people it doesn't. For people that have significant core weakness, they can also get this.
If you want to set that a little closer, that people can see it. Yeah,
There you
like
go.
that. That's pretty
Perfect.
good.
So this image kind of shows that there can be a gap, but if you have strong muscles underneath, the gap isn't a concern anymore. It's when there's a gap in doming and your muscles are weak and you can't stabilize that tissue, that can contribute to low back pain and pelvic floor issues as well.
Very interesting.
So
Crazy.
I didn't know any of that.
Yeah.
So you're doing screenings for that as well.
that will be part of the screen. And then the last part of the screen, of course, what we really focus on a lot is pelvic floor issues. So we'll be doing a questionnaire and you just fill it out and it goes over, do you have sciatic issues? Have you ever had a fall on your tailbone? Do you have pain with intercourse? Do you have constipation? different questions that all play into pelvic floor dysfunction. And depending on how you score, it gives me a really good idea of if you need a pelvic floor exam. We do not do that at the free screens.
Sure.
We would schedule you for an appointment, actually do the full assessment. And the screens are really just a basis of people understanding, no, that's not what's causing my issue, or, oh, that is. And then, yes, we can help you with that. But then we really have to do an in-depth, the 2-hour evaluation to really put it all together, because hip weakness, there's so many things that contribute to all this. It's not just one simple thing of your SI is off alignment. It's like, well, what's causing that? Typically, it's a hip weakness issue. Muscles are being too tight, and we address the full picture.
Very interesting.
Wow.
Yes.
Yeah. So you guys do a lot for a lot of people in the area, getting more and more all the time. So if somebody would like, you had like 3 openings.
3 openings tomorrow, 11:30, 3, and 3:20 p.m. And then next Thursday, we have quite a few more openings.
Okay.
But you can go to our Facebook page to also sign up for those if you want. We have a link underneath the screens where you can just go online and sign up for a spot. And then if you're not tech savvy, you can always call our clinic too. It's 217-705-5077. Again, that's 705-5077. We will probably not be able to get you scheduled the rest of this evening, but tomorrow morning, if you call tonight and leave us a voicemail, we'll call you right back and get you scheduled for a screen.
Okay.
What I need to know now is, did you and your kids enjoy the egg extravaganza?
We did. We did.
Very good.
And I'm not going to lie, I use those eggs again.
There's nothing wrong with
Yes.
that.
Recycling.
I'm like, we got so many eggs. I'm like, we're going to use these for an Easter egg hunt tomorrow.
Awesome.
There you go.
Perfect.
Good deal. And did you get to check out the eclipse?
We did. We all of the clinic, we were out on the back patio watching that. It was a really cool experience.
It was.
It was
Kind
an
of-
exceptional
Well,
day.
it was once in a lifetime.
That's right.
Yep.
Yeah.
Good
type
stuff indeed.
experience. So
Very good. Always a pleasure talking to you. Good luck, and stay out of the rain today, okay?
Thank you.
All right, stick around. More fun coming up here on The Drive Home.